Okay, and welcome to Behind the Knife's quick ABSITE Mnemonic review. I found this really nerdy guy at my program that has a lot of mnemonics that he uses and teaches us every morning at Morning Report. So I figured the Behind the Knife listeners would also like to learn some. So Chris Marenko is one of those weirdly smart people and has basically everything memorized. So he's going to teach us some of his memory devices to memorize everything for the ABSITE. So welcome, Chris, and thanks for helping us out.
Okay, everybody, good afternoon. Just real quickly, a disclaimer. Some of these you might remember from step one, some you might have seen as part of Pfizer, some TrueLearn. A number of them I've made up myself or got from other people in the program, so hopefully they're new to you and they help you score them all on the ABSITE. So let's get started. This is an oldie but a goodie, a favorite from step one. It's called Chemo Tox Man. So bear with me, it should just take a second. So this will help you remember the side effects of chemotherapy medications. And it's like drawing a little man. So start with the head, and then he's got two lungs. He's got a heart that looks oddly like a D with a T in the center. He's got two arms with V's for hands. He has kidneys, of course, and ears, which look like C's. Finally, a bladder that looks like a sideways C with a Y, and two legs. Okay, so let's go through it really quickly. First off, the B's for his lung. Remember, bleomycin and busulfan, pulmonary fibrosis. The C's for his kidneys and for his ears. Remember, nephrotoxicity and ototoxicity associated with cisplatin. The V's, vincristine, that's associated with neurotoxicity, causing peripheral neuropathy. The D, with the T in the center, that helps you remember the two medications, chemotherapy medications associated with cardiomyopathy. That's doxorubicin at doses greater than 500 and trastuzumab. And finally, the sideways C with a Y, cyclophosphamide associated with hemorrhagic cystitis. Just so you know, it's also associated with gonadal dysfunction and renal failure. A quick sidebar on the C's. So remember cisplatin, ototoxicity, and nephrotoxicity? There are two other medications that also do this. I have a sidebar mnemonic, VAC, V-A-C, to remember those three medications. Vancomycin, okay, aminoglycosides, and cisplatin. All three of these cause both nephrotoxicity and ototoxicity. And one more branch point, if you're still with me. Aminoglycosides. How do you remember which antibiotics are aminoglycosides? I use NAT. You have to remember there's a G, a silent G. G-N-A-T. So that's gentamicin, neomycin, amikacin, and tobramycin. All right, if you're still watching, we'll keep going. Let me just wipe down the picture. So one of the most painful things to remember are PNETs, pancreatic neuroendocrine tumors. And one of my co-residents, Daniel Lammers, came up with an excellent visual aid to remember these, specifically to remember the location because that's a very high yield. So first off, I want you to have in your mind the picture of a pancreas. So we start off with the pancreatic head, okay? And then we have a nice long pancreatic main duct. We have a pancreatic tail, okay? You got a nice little spleen hanging out over there. And then for the purposes of the mnemonic, remember there's a little S right there, okay? So starting off with the head. This big G, you're going to remember in the head of the pancreas is gastronoma. You might remember in your gastronoma triangle, okay, which is made up of the junction of the cystic duct and the common bile duct, the junction between the second and third part of the duodenum and the neck of the pancreas. So it's easy to remember gastronoma is in the head. So gastronoma in the head, also associated with somatostatinoma in the head. This sideways eye, which kind of acts as the main pancreatic duct, is insulinoma. That's found throughout the pancreas equally. in the tail, you have this sideways V. Remember, that's vipoma, predominantly found in the tail, along with your other G, which kind of looks like your spleen. That's glucagonoma. Okay, let's keep moving. Okay, so another thing that's painful to remember is some of the particular equations, specifically for FeNA. Okay, you might have to calculate this as part of the test. So FeNA, I think we all remember it's something times something over something times something else. Now that's not very helpful if you don't know what any of the four things are, but here's my mnemonic. It's called PUP. So it goes P, U, U, P. PUP. Times, times. Now how do you remember which one's associated with creatinine and which one's associated with sodium? Just remember C comes before N. So C-R-N-A. C-R-N-A. And there's your equation for FeNA. Plasma creatinine times urine sodium over urine creatinine times plasma sodium. Okay, keep moving. Okay, so gastric ulcers, 5 types. 2 are associated with decreased mucosal protection. 2 are associated with increased acid production. How do you remember which ones they are? So, I just do 1, 2, 3, 4, okay? And the mnemonic here is MAM. So M-A-A-M. You can use an apostrophe, if you're from the South or in the military. So M, decreased mucosal protection for 1 and for 4. For 2 and 3, it's increased acid production. Cool? All right. Next up, so 2 high quality anatomy points. First off is the order from anterior to posterior of structures in the thoracic outlet. So mnemonic here is V-man. So V is your subclavian vein. M is your muscle, that's your anterior scalene muscle. A is your subclavian artery, and N is your nerves, specifically your brachial plexus. Okay? One little caveat to this that may be important is that the phrenic is just anterior to the anterior scalene. It didn't fit into my mnemonic, so I left it out, but you should remember it. Another important one more real quick, that's anterior to posterior. Another quick anatomy mnemonic from anterior to posterior in the renal pelvis. So I use VAP. So vein, artery, and then the pelvis. Yeah. All right, let's keep moving. So I think we all remember the components of some of our blood products like FFP, but I think cryoprecipitates is probably the hardest to remember. So it contains 4 different things. Only a couple of them are important for you to remember. It contains 8, 13, von Willebrand factor, and fibrinogen. How do you remember that? Or at least how do you remember one of them? So I remember cryoprecipitate. Cryoprecipitate. That's why you can use it to treat hemophilia A, which is a factor 8 deficiency. All right, keep moving. Okay, next, this is one of Kevin's favorite. So thinking back, again, the coagulation cascade, it's hard to remember what's associated with what. So this is WEPT, W-E-P-T. So warfarin is associated with the extrinsic pathway, which is characterized by the PT, WEPT. Okay? Next up, hypersensitivity reactions, 1 through 4. 1, 2, 3, and 4. What's the cause of each one of them? So the mnemonic here is acid, A-C-I-D. So A is your anaphylactic, allergy, atopy reactions, okay? C, cell-mediated. So the cells make antibodies causing Graves' disease and other problems. I, immune complex mediated, like serum sickness and SLE. And then D, delayed type hypersensitivity reactions, contact dermatitis. You guys know all this. So for anaerobes, remember clinda above the diaphragm and flagell below the diaphragm. Easy way to remember that. Okay. So this one you might remember from your wards. It's almost certainly one you've heard before, CB-dial-K. So this is for the treatment of hyperkalemia. And I like it because the first thing in the mnemonic is the first thing that you do in somebody with symptomatic hyperkalemia. So it's CB-dial-K. And the last thing is often the last thing you do. Anyway, so C, calcium gluconate. That's to stabilize the myocardial cells. B, bicarbonate. D, dialysis. That's probably the last thing or second to last thing you do. I is insulin. Remember to give it with dextrose. A is albumin or a beta 2 agonist. L is Lasix. And finally, K is K-exalate. Okay. Next is the electrolyte imbalances associated with refeeding syndrome and with tumor lysis syndrome. So they're easy to remember because they're flip-flopped. So first off, tumor lysis syndrome. Some of you may have family or friends who make a lot more money than you that work in the financial industry. There's a company called KPMG. Okay? And in tumor lysis syndrome, it's hyper-KPMG. So that's elevated potassium, phosphorus, and magnesium. Also uric acid. And in refeeding syndrome, it's exactly the opposite. So it's hypo-KPMG. All of them go down, particularly phosphorus. All right, next up. So sticking with nutrition and electrolytes. So one thing that I've seen a question or two about was overall protein deficiency. It's called kwashiorkor. Now, it's kwashiorkor and marasmus. Just remember, kwashiorkor, terrible spelling, is equivalent to protein malnutrition. And they both have O's. Marasmus doesn't have an O. It's not a great one. We'll keep moving.
But in kwashiorkor is squishy.
It's very squishy.
And they're squishy because they are hypoalbumic.
And they have big bellies.
A lot of edema.
Next is how to remember zinc deficiency. So I remember zinc deficiency is like anti-Wolverine syndrome. So Wolverine, he heals really fast and he grows a lot of hair. If you have a zinc deficiency, you will have wound healing abnormalities and you also lose your hair. So next up, we're going to talk about the men syndromes, highly tested. So first off, how do you remember the components of each of the syndromes? So I throw back to step 1 diagram. So we have men 1, men 2A, and men 2B. So for this one, you remember diamond, square, triangle. Okay? And this correlates to the location of the disease processes in each patient as if this was a little guy. His head and his body. Okay, so if you're trying to remember the order of the figures, just remember it's alphabetical by the first letter. So diamond, square, triangle. Anyhow, so let's just recall really quick. Men 1 has pituitary tumors, it has parathyroid hyperplasia, and then pancreatic tumors, where 2A has the parathyroid hyperplasia as well as pheochromocytomas. And then finally, 2B has the pheochromocytomas, but oral mucosal tumors. And remember, 2A and 2B both have the association of medullary thyroid cancer. Now, one question you might see is which is worse, 2A or 2B? And just remember, 2B, bad, is worse and has a worse prognosis. One other thing is that you might see what the age for prophylactic thyroidectomy for medullary thyroid carcinoma is, and in 2B it's at the age of 2, in 2A it's at the age of 6, and that's because 2 is worse, higher risk. Okay, moving on. If you're like me, you have a hard time remembering what different immunological cell functions do. So if you remember eosinophils, so they control the function of basophils as well as mast cells. Both basophils and mast cells secrete histamine and part of your allergic reaction, but basophils produce histamine that's released in the blood. And I remember B for blood, whereas mast cells release histamine into the interstitial tissues. Okay, next up, so after a patient undergoes splenectomy, vaccines. What vaccines do you want to give them? So the mnemonic here is SHIN. So that's strep pneumo, Haemophilus influenza, and Neisseria meningitidis. Those are the encapsulated organisms that you lose your resistance to when you have a splenectomy. Next up, so the majority of sarcomas are disseminated hematogenously, with a couple of exceptions. And the mnemonic here is SCARE. So these are the 5 types of sarcomas that disseminate through the lymphatic system. And it includes synovial cell, clear cell, angio, rhabdomyo, and finally epithelioid. Next up, we're talking about congenital adrenal hyperplasia. This can sometimes be a tough one. You probably heard this one in your adrenal talk with Behind the Knife. So the thing to remember here is you make 2 columns and you put the number from the first part of the enzyme deficiency into each column. So 21, 17, and 11. And in the first column, you think about aldosterone. In the second column, you think about testosterone. And then you have either a 1 or not a 1 in each column. If there's a 1 in the column, you think about that as an up arrow. So in 21 hydroxylase deficiency, you have an increase in testosterone, which means you'll have virilization in females. However, there's no increase in aldosterone, so you get hypotension. In 17, on the other hand, you have an increase in aldosterone because of that 1 in the first spot, but no virilization. And finally, in 11, you get both an increase in aldosterone, so hypertension, and an increase in testosterone, so virilization. So next up, this is also about men syndromes. So specifically, what tumor do you take out first? I'm a big Phillies fan, so we use this a lot, but so Theo comes out first. The reason for that is it can lead to hemodynamic instability if you try to take out another one of the tumors first. And one other thing is when you're resecting a pheochromocytoma, you want to keep the patient full. So high intravascular volume to promote blood pressure stability during and after the procedure. So this is a small anatomy point, but I did see a question on TrueLearn this year about it. So you have both the medial and lateral pectoral nerves. And the thing to remember here, if I can spell, is that medial innervates both the major and the minor, all of which have ends. Whereas the lateral pectoral only innervates the major, which makes sense. It's bigger, it needs more nerves. So 2 quick points on lung cancers. So associations. You have small cell, you probably all remember this, has the 3 A's. So it has, in terms of paraneoplastic syndrome, it has ACTH, ADH, leading to SIADH, as well as antibodies against calcium receptors, which causes that Lambert-Eaton syndrome. Squamous cell lung cancer, one of the non-small cell, has the 3 C's. This includes the fact that it's usually centrally located, is associated with cigarette smoking, and is associated with hypercalcemia through the PTHRP pathway. Okay. Real quick, how do you remember the medications for testicular cancer? The mnemonic here, forgive my French, is eradicate ball cancer, or EBC. That helps you remember etopside, bleomycin, and cisplatin. Okay? And that's indicated for seminomatous, that either has bulky retroperitoneal disease or metastasis, and indicated for non-seminomatous greater than stage 2 or greater. Next, 2 quick innervation things. When you're remembering the innervation of the foot, remember tip and ped. So that's the tibial nerve causes plantar flexion and inversion, whereas the peroneal nerve causes eversion and dorsiflexion. Meanwhile, in the hand, remember dab and pad. So the dorsal interosseous causes abduction, whereas the palmar interosseous causes adduction. Okay, moving right along. So I didn't necessarily expect to see this, but once again did have a question on it in Drooling this year. So in terms of the mechanism of action of benzodiazepines versus barbiturates, the thing to remember here is that they both inhibit the GABA receptor. However, Ben likes it more frequently, whereas Barb likes it to last longer. So benzodiazepines have to do with the frequency of GABA, and barbiturates have to do with the duration. Next is location or the relationship of the left and right vagal trunks to the vagal nerves themselves. So this is from one Dr. Carter, LARP. Some of you may do this in your spare time. The left vagus rotates to become the anterior trunk of the vagus, whereas the right rotates posteriorly to become the posterior trunk of the vagus. So when you're approaching the esophagus in surgery, this is kind of like a military memory. So remember left, right, left. So in the cervical esophagus, you want to approach it from the left side. In the upper thoracic esophagus, you want to approach it from the right side. And in the lower thoracic esophagus, from the left side again. So left, right, left. All right. Very quickly, in terms of gauging the severity of hepatic disease, MELD score and the Child-Turcot-Pugh score often see questions about what the components are. So MELD is BIC, and Child's Pugh is a beep. So MELD, bilirubin, INR, and creatinine, whereas Child-Turcot-Pugh is ascites, bilirubin, encephalopathy, albumin, and PT, which is equivalent to INR. And remember that MELD is more accurate because it only includes objective measures. Next up is components of Crohn's disease. So the mnemonic here is guts. So Crohn's disease includes granulomas, it includes ulceration, it's transmural, and has skip lesions. The transmural is very important because it gives it the characteristics of fibrosis and the ability to cause strictures as well as fistulas. Very quickly, the components of the Cantrell Pentalogy. So I remember scoped. All right. So this reminds me of the 5 elements, all related to the heart. Sternal anomalies, cardiovascular anomalies, omphalocele, pericardial defects, and a diaphragmatic defect. Those are the 5 features. If you can remember that they're all close to your heart, you'll probably get there. Next is trocar placement in for lap appy in pregnancy. So I just write 3 plus signs, and then first, second, and third trimester. So I think we're all familiar with the standard port placement. You got umbilicus, your camera port. And the thing here is that the location of your other ports rotates clockwise as you go through your pregnancy. So it starts off here in the left lower quadrant and suprapubic. That's normal standard port placement, which you use in the first trimester. In the second trimester, it rotates, so you have one in the left lower quadrant, but now your suprapubic moves over to the right lower quadrant. And finally, in your third trimester, it moves over so that you have it in your right lower quadrant and your right upper quadrant. Next is a few quick words on cardiac anomalies in children. So you have your left to right shunts and your right to left shunts. Your left to right shunts I think we're all familiar with. Your VSD, your ASD, your PDA. The right to left shunts are a little bit more difficult to remember. The mnemonic I have is the 5 T's. So this includes tricuspid atresia, transposition of the great arteries, total anomalous pulmonary venous return, the tetralogy of Fallot, and truncus arteriosus. For the tetralogy of Fallot, my little mnemonic is prove. So the 4 components include pulmonic stenosis, which of course leads to right ventricular hypertrophy. It's also associated with an overriding aorta and a VSD. Okay, last quick things. So in terms of the location of parathyroids, it all has to do with the location of your inferior thyroid artery and your recurrent laryngeal nerve. So assuming this is medial and this is lateral, this is superior and this is inferior, your horizontal element is going to be your inferior thyroid artery, and your top to bottom is going to be your recurrent laryngeal nerve. Over here, lateral to your recurrent laryngeal nerve and superior to your inferior thyroid artery is your superior parathyroid. Medial to your recurrent laryngeal nerve and inferior is your inferior parathyroid. Last quick things. Once again, saw a question on this year. The supply of blood to the hand. So most commonly predominant from the ulnar artery. And you can remember that the ulnar artery supplies the superficial arch. And the U's there is going to help you remember that. Last thing is most common inguinal hernia is going to be indirect in men. And that helps you remember that it's most common in men and then indirect is the most type. And that's all I've got.
Well, thank you, Chris. Really appreciate dumping your brain on the whiteboard for us. And good luck to everyone on the ABSITE.
Take care.